Hello, welcome to the Kansas State Veterinary Diagnostic Laboratory YouTube channel. This presentation discusses bovine abortion necropsy submissions.
Okay, so I'm Kelly Alms, one of the pathologists in the diagnostic lab, and we're just going to kind of start here. I'll do a few slides, and then Dr. Lubers will take over and kind of go over some summary bovine abortion information for the lab as a whole. So I guess the main questions that we see from practitioners are, what do I send, what tests do I run, and what am I going to find out? So with bovine abortions, it really depends on, I guess, how far you want to go, how soon, before it becomes a big problem for the producer. So I'm just going to start out by going through a case example, and then sort of as I go through that, talk about ideal sample sets and that type of thing. And I'm going to talk about everything as if you guys want to take the samples and send them to us, but always feel free to send us the fetus and we'll take the samples for you and do all the work. And I know people don't want to ship. It's pretty heavy. We do have reduced shipping now, so that might help a little bit. I also had a submission 2 weeks ago. I've never had this happen, but it was actually pretty clever. I don't know if the person is in the room that sent it, but they actually cut the legs off and just sent the rest of the calf. It fit in a much smaller cooler and it weighed less. So as long as you're not going to come back later and ask me if I saw arthrogryposis, then we're fine. So that works. All the samples were there. It saved them money. So that worked out quite well, actually. So this case example was an 8-month gestation Angus fetus, third abortion in 4 to 5 days in the herd. I do not know the number in the herd, so I can't really do a percentage off that. And they weren't due to start calving for another 3 weeks. So all of these were obviously premature. So what do I send? So you'll find in the back of your proceedings for today some different workups in a format that maybe will encourage you to rip them out, put them in your truck, make copies of them, whatever. Feel free to keep them with you. This is the bovine abortion one, and obviously this is the ideal full sample set. So if we get the fetus on the necropsy floor, this is what we're going to take. So you can see here, I kind of tried to break it up. So this is all of the different sort of wordy instructions that you can probably skip over if you want to. These are the routine tests that we're going to run, and we'll kind of get back to that in a minute as well. And then this is basically all your supplies and tissues, samples, fluids, that kind of stuff. I've listed down here additional available tests, and the reason that is because we don't routinely do nitrate levels. That's been a pretty high request this year because of the drought and feed. People, even though they've tested feed, they're started to have abortions, they want to test the fetuses as well. And that's something we can always do anytime. It just takes an additional sample. We need one of the globes or ocular fluid from the globe to perform that test. So if we just kind of zoom in a little bit closer here, so here's the ideal list of samples that we want from you guys from the field. And I guess I would just start off by saying that probably the 2 most not sent samples are placenta and brain. We have seen a lot of placentitis this year, both bacterial and fungal. I don't know why it's so much this year, but placenta is really important. So even if it's laying in a big pile of mud or manure or whatever, still send it. We can rinse it off. And preferably we'd like some fixed and some fresh. We typically don't do anything with the fresh placenta unless we see lesions on histopath, but if we don't have it, we can't even try to isolate what's there if we don't find it anywhere else. So all these fixed tissues in formalin, brain, I mentioned that we typically don't get it. It is really important in the case of neospora. So especially if these are late-term abortions, we would really like some brain. The only lesions it's going to cause is multifocal necrosis in the brain, and occasionally it'll cause some myositis in both cardiac tissue and skeletal muscle, but more commonly we see the brain lesions. So I'll mention that we don't get it very often. Rest of these tissues, basically we're looking for evidence of infectious diseases, septicemia, those types of things. Fresh tissues up here, so obviously we're going to use those for cultures, checking for viruses, that type of thing. And then our fluids are pretty important. So abomasal contents, I have 2 tubes listed up there. And under the testing, it says currently we are validating TRIC PCR on abomasal fluid. So a lot of people think that Trichomonas can be an abortogenic agent, and there is really no good way to test for it. In other countries and at other universities, they're looking at this as well. So doing the routine Trichomonas PCR testing on abomasal fluid to try to identify that agent within the fetal tissues. It should be a validated test pretty soon. This time of year, we have a lot of samples to work with, so we're validating that as fast as we can. Oh, thank you, Dr. Lubers. So Dr. Lubers asked if any kind of tubes were appropriate to put that in. So you want to put it in a non-additive tube. So don't put it in a purple top. Put it in a red top or put it in a sterile tube with no additive. If you want to leave it in the syringe, you can even do that, but please remove the needle. I would really appreciate that. That doesn't always happen, but if you can remove the needle before you ship it, that's great. You have little stoppers or just the cap without the needle on the end. And then the other tube we're going to use for bacterial culture. And we do what we call an abortion panel on that, but it's just for the bacteriology portion. So that's going to be a regular aerobic culture, a Campi culture, and a Brucella culture. And that is truly the best sample to do cultures on to try to find any agents. So those two samples, yes.
Would you use the in pouch if you're looking for trick?
You could use the in pouch if you want to send that to us, or you can just send us the fluid and we'll take care of that part. So we'll inoculate when it gets here, incubate, that sort of thing. So if you have it, that's fine. If you don't want to try to juggle all that stuff, that's fine too, either way. The thoracic fluid, that could just as easily say pericardial fluid or heart blood. So we're going to use that in place of serum and do serological tests on that, blue tongue, Neospora, BVD serum neutralization. And I would just, I guess, put my own personal spin on that or bias. I've seen a lot of cases where you have a negative BVD PCR because the virus is gone from the tissues, but we hit on the BVD serum neutralization and the fetuses have a very high titer. So they were infected in utero, but the virus has actually cleared from the tissue, so we can't find it, we can't sequence it, we can't do virus isolation on it, but we can tell that they have titers to it, and so then we can trace it back and relate it to a BVD as at least that the herd was infected, and that's most likely the cause of abortion. Pretty much it on this slide. So like I said, thoracic fluid or pericardial fluid or heart blood, we can use those all the same. And that is just as easy to put in a red top tube as well, or if you use the clear Falcon tubes with the snap tops, whatever you typically have for supplies are fine. So what tests do I run? So most people will just leave it up to us, which is more than fine with us. So pathologist discretion or lab discretion. We have our typical test workup that we do, which is also on this form and kind of zoomed in on that. So I already mentioned the BAC-T abortion panel, and we, like I said, prefer to do that on abomasal fluid. If we do not have abomasal fluid, we can do it on liver and lung. Those samples are just not as productive, I guess you could say, on culture. In the molecular lab, we typically do a PCR test for leptospirosis and BVD, and as I said, we're currently finishing up validating the TRIC PCR on abomasal fluid. And then there's the serology test I mentioned, which we'll do on whichever kind of fluid you send us, blue tongue, BVD, type 1 and 2, that will do both types, and then Neospora. And then histopath, obviously, as a pathologist, that's my favorite one to do. So looking for any signs of septicemia, we can see general lesions like that, and sometimes we can't get the bacteria isolated just because it wasn't there anymore to find, but we might be able to see histologic lesions. And also a negative histopath, I guess, is just as useful to say we don't see any sign of infectious disease. You know, I would definitely invite you to speak with the producer. We've had a couple abortion workups. The one I can remember the best, I said, you know, were there any management changes? And they said, well, this was the first abortion, and it was from the pasture of heifers, and they had loaded everybody up and moved them during a snowstorm and then ran them all through the chute the day before. So they probably didn't need to spend $230 on that workup because they probably knew the reason for that in the first place. So always kind of keep that in the back of your mind, and rarely do we get extensive histories, but sometimes those are helpful to kind of help us target in and investigate something further. And then like I mentioned before, nitrate levels. just send the whole eyeball. It's much easier for you guys to take out than messing with trying to get fluid, and that is a color change test. So if there's hemolysis or anything in that fluid from you guys taking the sample, then they can't run it. So I always find it easier to send the eyeball, let them take the fluid out, and then there shouldn't be a problem with that. So.
We have a question, Dr. Holmes.
Yes.
What are the main history points you like to have that are helpful?
The main history points, so it's really nice to know, how many abortions there have been within what time period, and then how many there are in the herd, or how many are due to calve, and are these heifers, are these mature cows, and if you've sent any other cases in from the same farm, please feel free to tell us that, because we will all talk to each other. We can look all those cases up. If there's something that you haven't tested for before, we'll make sure to test for it this time, or just more minds thinking about the same case would be helpful. And another thing I didn't say, but obviously I know sometimes these fetuses are scavenged, so you don't have all the tissues to send us, and obviously we understand that too. So I would just point out mummified fetuses are pretty non-diagnostic samples. So if that's all you have, probably not worth the money to do the testing. Still feel free to send it in for a necropsy. We'll see if we can find any structural abnormalities, but as far as the testing goes, not worth the money, and we'll usually call you and talk to you about that. Doesn't look like anything on histopath, and you probably won't be able to find any infectious agents. And then virus isolation, kind of as a backup to any of those PCR tests, and there is a chance that we could isolate different viruses, but most of those are going to cause histopath lesions as well. Question?
I was wondering, would you want to know vaccination history as well?
Typically that's important, especially if you know the history. There is the modified live that's approved for pregnant cattle, but did they pre-vaccinate as called for by vaccine protocol is pretty important. So obviously we'd be worried about IBR there. Typically causes classic histologic lesions, but it would be good to know what their vaccine history or protocol was on the farm, if you know.
Here's another question.
Yes.
I was wondering what percentage of your case of diagnostic workups or abortions go undiagnosed?
Well, can we put you, the question was what percentage of the cases go undiagnosed for abortion workups? Can I hold you off for about 2 slides? It's a great question. We actually answered it.
Dr. Lubers is going to give you all that information here in just a minute. So to end this case up that I talked about, so the samples that we received were fixed tissues, and we did get brain, so we did histopathology on that. I did get abomasal fluid, and I performed the bacterial abortion panel on that. Heart blood was sent, so we were able to do our serology testing, and they did send a globe, and they did want nitrate testing. So here's our results from this workup. So nitrate levels were below 10 milligrams per liter, which is non-toxic or within normal levels. BVD serum neutralization, nothing hit there, negative blue tongue, negative neospora, but the bacteriology culture hit a pure culture of Trupperella pyogenes, which is formerly Arcanobacterium pyogenes, formerly Carinobacterium pyogenes. So whatever. So whichever name you know it by, it's called Trupperella now. So, and having fixed tissue, I was able to confirm that that was truly the cause of abortion. We had a suppurative pneumonia with a ton of intralesional bacterial organisms. And being a pathologist, I can't let you out of here without making you look at microscopic pictures. So this is a picture of the fetal lung, and right here there's a nice bacterial colony and some neutrophils and fibrin. If we zoom in on that, you can start to see the little purple dots of bacteria. And there was actually a really large number of bacteria in multiple sections of lung. Again, this is an airway. This is a bronchiole right here. Lots of bacteria within the airway, and again, neutrophils and fibrin. And that's meconium, just in case anybody thinks that's interesting, probably not. And this is a gram stain of that same bronchiole. So this is the wall right here, the respiratory epithelium, and then all of this was debris in the airway, and then all of the little tiny dots, I have a closer up picture here. Oh, no, I don't. All the little tiny blue dots, those are all bacterial organisms. So, and actually, something Dr. Lubers reminded me to point out about this case. So they cultured Trupperella, or do you want to? Okay, never mind. I'm going to give away his. Okay. So any questions about that portion? Yes.
How much autolysis stand? I'm assuming if there's any or we detect it, running all this is really not worth doing.
So degree of autolysis does matter. Dr. Lubers is going to point that out again later. So yeah, you got to kind of use your judgment in the field as to whether you think it's going to be a diagnostic sample or not. Yes.
If I let you have pathologist discretion, how much are you going to charge me versus if I choose and pick?
Well, if you pick and choose, then it's going to be whatever you pick and choose.
The question was if a practitioner checks pathologist discretion, which is actually a box on our submission form. There's actually a checkbox for it. How much will that cost? Sorry.
So if you check that, I'm going to do the first part of these tests. So I'm going to do this routine testing here. This I will not automatically order unless you request it on the form. That right there, including the trick PCR, which would soon be available, is going to be somewhere between $210 and $230, I believe. I don't know the exact number. So if you pick and choose, obviously it depends on what kind of testing you pick, but just know that we hope you pick the right one.
It's not so much picking the right one, but you checking specific tests ties us into that specific testing. Unless there's something that comes up, if you did not check histopathology, you would not do histopathology, which may not give you an indication of something that we could go on and do further testing. So it's not so much just not picking the right one, it's tying us up a little bit to help you with the case. So it's my turn. Do you have a question? Okay. It's my turn. I think I'm presenting because I run the bacteriology lab. I think I'm presenting because I drew the short straw. I want to ask, I'm sweating up here trying to figure out how to present this. I'm going to ask the question here. So what's been your experience with percentage of diagnoses from abortion workups? You asked the question, so I'll put you on the spot. 1? 10%, okay. Other experiences? Similar? Kind of? Okay. Well, that was 2012. So unknown is basically the category of undiagnosed. So we'd say 60%. Like I said, this is from 2012. And if we go back in time, we can see it's relatively consistent despite pretty significant advances in technology. We've got much more PCR now, much more sensitive tests, different tools. This also, there are changes in personnel, obviously, so all those things. But if you look at it, maybe down here in non-infectious, you can make an argument that there's been a shift. The case numbers, I can't remember off the top of my head, but they're relatively few. So a few cases this way or that way can shift the percentages. If we did statistics on it, we didn't, probably wouldn't find a statistical difference. So we thought, well, that's not very good. So we went and looked at another lab that's here in the Midwest that has kind of the reputation for being good at doing abortion workups. It's pretty much the same thing. 60%, 57 to 59 were the comparisons, as far as basically unknown or undiagnosed. So then we start to say, well, why is it like that? What's going on? We've got a couple things that we can offer for suggestions. I'll put up here first the things that we, meaning you and us together, can't really control with these workups. Autolysis was mentioned already. That's probably a significant one. We know that when we have autolysis, that it does decrease the sensitivity of a lot of our testing. So that would be one. Other things that you guys have probably thought about, talked to producers with, those kinds of things. Maybe most abortions aren't infective. We emphasize the infectious causes, but maybe things like snowstorms and running through a chute. I know we had a case late last year or earlier this year that actually turned out to be anaplasmosis related in the dam. So, that would be technically infectious, but it was really more of an individual case, not a transmissible, not a contagious infectious like we're looking for with most of these workups. The causative agent has already come and gone, and then the delay between fetal death and expulsion, what is happening in the fetus. What we find at the time of abortion is really a picture of maybe weeks to months prior. So those are the things we can't control. We don't know probably exactly what degree each of these affects. The things we can control, and this is, Dr. Alms has kind of mentioned this, and this is kind of our take home for you guys today, is that not having the full set of tissues oftentimes will prevent us from having the diagnosis. And placenta keeps getting mentioned, and I put her off for this specific reason. So the case that Dr. Alms presented with the Truparella or Canobacterium or whatever it's called now, pyogenes, that diagnosis, the original result that came out of the BAC-T lab was Truparella pyogenes, probably a contaminant, was the comment that was made. And without placenta, without Dr. Alms looking at it and saying, yeah, we do have placentitis, and we looked at the bacteria, they were consistent with Truparella pyogenes, so it was really putting those two things together. We pulled our probably a contaminant comment off of the report, and enabled us to make what we are pretty sure is the definitive diagnosis. So if we're missing either of one of those, we don't have enough evidence to corroborate the diagnosis in the case. So it really is a big issue. I know that there is a long list of samples that we require for abortions, and it's really because many of the agents have very special needs. You've heard about neospora in brain and potentially skeletal muscle. Those kinds of things, it really is something that requires all of that. I think one area that we are really recognizing that is important for you guys is the collaboration between us that you don't see. In that case, Dr. Alms called and said, hey, I've got severe placentitis. What do you guys grow in the lab? We said this, but it's probably a contaminant. Well, maybe it's not. Let's get this report out. So hopefully that'll come out, and you guys will see more of that as we start to emphasize client care this year. The other thing, and we've really kind of mentioned that already, is that entire set of tissues really helps us to make our story more complete for you and get a definitive diagnosis. The other thing, while I've got the microphone for just a few minutes, I want to go either of these slides. It doesn't matter. When we have 60% of our cases that come out as an unknown or a not definitive diagnosis, I guess as a former practitioner, I understand that often clients are making the decision on whether to submit or not. We've got one, that's an incident. We've got two, that's a coincidence. We've got three, we've got an outbreak. And that's normally kind of what we hear. The case reports are, this is the third abortion in the herd. I guess armed with this evidence, maybe something that you can take back to your clients is, maybe we don't wait for the third one. Maybe we wait for the right one. And so if the first abortion that you have is a non-autolyzed, fresh fetus, and you can find the placenta, maybe that first one is the opportune time to strike, rather than waiting for the third one, which isn't the ideal sample, but the client's getting nervous, and then you have to wait for the fourth one, and you're already, another 2 or 3 weeks down the road. So that, for me, it's just, I think, another take home after looking at all the records analysis that we've done here within the lab. So if you have any questions for either Dr. Alms or myself, yes?
Did you see an increase in the number of toxin-related abortions?
The question was, did we see an increase in the number of toxin-related abortions? I'll have to ask the pathologist because I don't see the whole cases. Jamie or Kelly?
I guess I would say that it's probably just mostly nitrate testing, and a lot of people tested their feed this year prior to feeding it. So I think if there was going to be any problems, it would have got headed off before it started, but I haven't seen any come back from the fetus that do have elevated levels of nitrate. One.
Dr. Henningsen said she had one. And I don't know total numbers for the year. How many cases have we had?
For this year or for 2012?
Well, yeah, this year.
This year, quite a few.
Yeah,
it's the time of year. So I know 2 weeks ago we had like 14 that week on the Necropsy floor or something. It was quite a few. So this is a pretty hot time of year for those to be coming in, as you guys know. So.
Yeah, another question?
Are you seeing any aflatoxin coming back? We're seeing some issues with corn
So the question was, are we seeing increased levels of aflatoxin-associated abortions?
I guess my answer to that would be that it's probably going to be causing disease in the dam and not the fetus. So we're probably not going to see anything on the fetus, and that kind of goes back to the history. So I didn't even say this, but what would be important on the history? So are the cows sick or not? If there is any liver lesions, anything like that, obviously we might be able to see those. And we can do, another thing, it's not really a toxin, but a lot of people have been worried about mineral levels. So we can do mineral analysis on the fetal livers, just like we can do on adult livers as well with the toxicology department. So some people are doing that, worried about selenium levels and stuff like that. Yep.
I had a client issue 200 cows with cold turkey from big bales of grass to big bales of corn. Third period at 4 or 5. They got abortion within 3 weeks to a month with no start getting. Found nothing. What kind of find?
So went from baled grass to baled corn, 200 cows.
Don't go cold turkey. Took it back off the 100% bale corn.
Okay.
We never found it.
We didn't find anything. Suggestions? Probably not infectious. And I think this is one of those where sometimes a negative result is a result because you probably knew what the answer was, right? I mean, you did, right? You knew what you were pretty suspicious of what. I understand that.
We do too.
Yeah.
Yeah, and it is frustrating sometimes. We always, Dr. Hennington and I's officer right beside each other, and we kind of announced through the wall when we found something on an abortion case because we're super excited that we got an answer. So everybody's kind of like that. We've had a veterinarian we've been working with for weeks now, one producer bringing in a couple a week, and we can't find anything in those things. And we're going way over and above what's on that list of routine testing. And we have no idea what's going on this farm. And so we just keep collaborating and talking to everybody and trying to see what we can do, increase different testing, think of things we haven't thought of before that we've never seen before. And like Dr. Hesse said, everything always changes. So just like starting to look for trick, maybe that's been in some of these cases and we don't know because we didn't test for it. So it'd be interesting to see what we start finding when we do start running that test. Dr. Lubers mentioned the anaplasm case last year. Severe anaplasmosis in the herd. It was because the cows were not well, ill if you will, but they were all aborting and it was just from their body condition and degree of anemia. Yeah.
Does anybody in here have a producer screen their replacement heifer for Neospora?
The question was, is anybody screening for Neospora? Incoming heifers, right?
Yeah.
Purchased animals or
Just doing serology.
serology? Is that what you're talking about? I don't see any. I don't see any.
There's a lot of that out there. A lot more people some interest.
There is a lot of positives for Neospora that we'll get, and actually one of the samples, we didn't really mention this at all, but kind of a sample we get frequently is serum from the cow, one serum sample from the cow, and they want us to run for abortion. They want us to screen for abortion causes. Well, we can check and see if there's elevated titers to anything, but one sample is not as good as paired samples, and knowing whether the cow had elevated titers still doesn't confirm whether that was the cause of the abortion. And Neospora specifically, there's a lot of cows in Kansas that are going to come up positive on serology, and the theory is that maybe the first year that they're pregnant after they get infected, they're going to abort, but probably not after that.
Oh, no.
But nobody knows.
Trust me, that's not right.
Okay.
And that the protozoal up here is
Yep.
Neospora. That's basically Neospora.
Yep.
But if you have a cow that aborts with excuse me, if you have a cow that aborts with Neospora, she's a hell of a lot more likely to abort with it again later. Trust me on that. There's no question. The guys in California will tell you that do the dairy stuff. If you do a bunch of embryo work, you'll find it. You guarantee it. Or maybe I should say you'll find it done too much.
Okay. We're actually kind of running over time. Are there any last questions that I missed? One more question.
Have you seen any modified live vaccine administered to calves, nursing pregnant dams that have not received modified live vaccine? Seen an IVR associated abortions? Those types of situations?
We have before.
The question was, have we seen abortions in dams off of calves that have received modified live vaccines, correct?
That weren't vaccinated with the same modified live
Right.
previously. We haven't seen that lately. We did see that when that vaccine was first labeled for use in pregnant cattle, because people weren't preconditioning with the same vaccination. But we haven't been lately. None that I know of this year, at least.
But there have been lots of examples.
Yeah. Throughout history, yes.
Thank you for tuning in to the Kansas State Veterinary Diagnostic Lab YouTube channel. If you have questions about this video or any of our services, please visit us at ksvdl.org.